Hello guys, this is Dr. Harper with Southeast Precision Clinic of Chiropractic, and we wanted to make a video today to dive just a little bit more in depth about upper cervical chiropractors, specifically the Atlas Orthogonal procedure, and we wanted to break down a little bit more about the importance of the upper neck area and how it can really impact your health. It can impact it in a very positive way if it's in the proper alignment, but also in a very negative way if it's not in the proper alignment. So we'll start off by talking about just upper cervical in general. Now, upper cervical is just a catch-all term that kind of encompasses a lot of different techniques with all having a very similar goal. Upper cervical chiropractors are doctors of chiropractic that are trained specifically in the alignment of the upper neck. Now, we focus mostly on three bones. The first one is your skull bone, or the top of your head here. Also, we focus on the next bone down called the atlas bone. That's the primary one of the three. And thirdly, the one underneath the atlas is called the axis, or the second cervical vertebrae. These three bones play a critical role in your neurologic health and your overall spinal health. So, as I was saying, when these bones are in proper alignment, things in the body work very well. When they're out of alignment, things get chaotic really quick. So, what I will talk about is how did the term atlas come about? Because a lot of people don't understand that. So, here on my, we have a statue, and this is actually the Greek god named Atlas, and he has the world sitting on his shoulders. And in essence, your world sits on top of your shoulders too, on the atlas, and that is your head. So your head actually weighs about the same amount as a bowling ball. The atlas bone itself weighs about 2 ounces. So very lightweight bone supporting a very large, heavy structure. So you can see the importance of when that gets shifted out of proper alignment. A lot of vulnerability happens right there where the head and the atlas meet each other. So let me show you here on this diagram on this model what we're looking at. So this here is the skull bone. Sitting directly under that is the atlas bone, and then directly under that is the axis or C2 vertebrae. So they work in a very unique way to kind of support this whole area up here. Now, something very important runs directly through the atlas bone and the axis bone, and that is your brainstem. And the brainstem area is very vulnerable to compression and a pinching, if you will, when these bones get misaligned. So patients in general, when they get a misalignment in the upper cervical area, they tend to display some very prominent symptoms. Not always in the beginning will you have these extreme symptoms, but there are some potentials to have major problems down the road if these misalignments are not corrected. So let's talk a little bit about how do we get a misalignment in the upper cervical area. A lot of people aren't real sure how that happens. So first off, anytime you've had any kind of car accident, trauma, slips, falls, bumps to the head, anything, even if it's as light as what most people consider a minor fender bender, can be traumatically dangerous to the upper cervical area. And we've even seen it in as low as 5 to 10 mile an hour impact is enough to damage the ligaments that surround the atlas and axis area and cause some pretty significant damage. So no matter how minor the trauma or accident, you can't always go on that and base it on whether or not you have a misalignment in your neck. Usually when the misalignment happens, you're going to feel some discomfort. There may be some muscle spasm around that area. You'll probably have some pain and tenderness. But as it progresses, we see people get a lot of neurologic symptoms. This can include headaches, vertigo, jaw pain, TMJ, even numbness and tingling all the way out into the extremities, and we're talking all the way to the tips of the fingers and toes, can happen when these misalignments, because ultimately you're putting pressure on a lot of nerves up here, and these nerves run from the top all the way down. So when the pressure's there, it's going to kind of cut that off, just like if you were kinking a garden hose, you're not going to get water out of the far end of it if this is kinked. So we want to make sure that the rest of your body is in ideal shape, and these upper cervical or atlas misalignments can a lot of times be at the root cause of why that's not happening. So let's talk a little bit about the atlas orthogonal procedure specifically, because there's lots of upper cervical techniques. They can be anything from hands-on techniques where the doctor's adjusting you using his hand. They can be instrument-based techniques, which is what we focus on here at our office. And so I'll break down a little bit about what we do. We use something called Atlas Orthogonal, which is a system that was developed by Dr. Roy Sweat in Atlanta, Georgia. And he used to adjust the spine by hand many, many years ago, and he found that he should be able to design an instrument or a machine that would be able to do something similar, but also give a level of specificity that was never available before. So with this instrument, we actually have the ability to give you an adjustment that is as unique as your own fingerprint, because no two misalignments are the same. So we want to correct your atlas misalignment with laser precision. We're talking down to the millimeter and degree, because your misalignment is as unique as your fingerprint, so why shouldn't your adjustment be that unique as well? So that's one advantage that the instrument has over hand adjusting, is that we can be very, very precise. So because of that, we use very, very little force. So a lot of times people are used to going to the chiropractor and getting kind of a forceful adjustment, or they might say, man, I heard a lot of popping and cracking and things like that. That's something that we don't do here in our office, because we use machinery and instrumentation that is so precise that we don't have to put in the amount of force that other chiropractors use when they do their adjustments. So because of that, we get really, really good results with a lot of these conditions: migraines, numbness, tingling, as I was mentioning. Also some things that people don't think about being related to the neck. We see an alarming amount of people in here with anxiety, depression, and also high blood pressure. Now, there's actually been some studies done on the atlas alignment and how it affects the blood pressure. So we have some patients that come in with high blood pressure that might be on several different medications trying to control that. And once we get their atlas back in alignment and it gets stabilized, a lot of times the blood pressure starts to drop, and they're able to even come off of some of those medications that they've been on for years. And it's just one of those really cool things that we get to link up the upper cervical area, and it doesn't even have to be related to pain. So we love seeing our patients get out of pain, and we love having that relief, but at the same time, it's so cool when we can see a patient gain the ability to come off of medications that they don't like taking. We can see changes like high blood pressure dropping. We've even had some patients with visual problems and sense of smell that's come back. We had a patient that couldn't smell, or she didn't know that she couldn't smell certain things. And since she's been getting her atlas adjusted, now she smells things that she's never smelled before in her life. And that's because all the nerves in the body come from the base of the skull and out. So, like I said, anything from eyesight to sense of smell, sense of taste, all of those things controlled right at and around the brainstem area. So when we get the pressure off, a lot of good things start to happen in the body, and a lot of them aren't even pain related. Pain is a very small subset of the major problems that you can have going on with your health, that we want to get to where we fix the problem. Yes, we want to get you out of pain, but we also want to take your health and optimize it to where it is not just about the pain, it's about your overall health and your ability to function and live the best life that you can live long term. So in addition to the Atlas Orthogonal technique, we do some other things on the spine. I have people ask me sometimes, do you do other things besides Atlas Orthogonal? And the answer to that question is absolutely. We do work with the other parts of the spine. Surprisingly enough, though, a lot of people come in with complaints of low back pain, hip pain, things in the lower spine, that when we get the neck corrected and we get that back in line, a lot of times the lower back pain goes away on its own and we really don't have to do too much to that area. So if we do have to work on that, we use an instrument called the activator, which is this guy right here, and it's just a handheld spring-loaded instrument that basically makes gentle, precise correction to the rest of the spine. And what we do is where we find misalignments, let's say in the lower neck area or in the lower back, we make a very specific contact to the side of the vertebrae here, and we give corrections in here. This is very comfortable to the patient, still does not involve any twisting, cracking, or popping. And we find that these two techniques work very, very well together, and we get some awesome results for patients with this stuff. So that is a little bit about what we do here, and we dove into a little bit more of the Atlas Orthogonal technique. Obviously, if anyone has any more questions, we're happy to answer those. If you want to come in for a consultation, we're happy to talk to you a little bit more about your particular case and what you've had going on, and try to find out if you would be a good fit for Atlas Orthogonal care and if we really think that we can help you. And that's one thing that I love about my philosophy, is that if I don't think I can help you, I'm not gonna tell you that I can if I don't think I can. So that's one thing I pride myself on, is we really look for the root underlying cause of your health concerns, and then we want to develop a plan that we think can get you the best results possible. And so I hope this has been helpful. I hope it's cleared up some of the muddy water that people may have regarding upper cervical, specifically Atlas Orthogonal. And once again, if you have any questions, feel free to comment on this video or give us a call to come in. We would love to chat with you a little bit more. So I hope you guys have a great, great day. Thanks.